So which of these thermometers is the most accurate? Which one is the most convenient when it comes to kids? And when you add 0.1 degrees, when you subtract 0.05 degrees, based on what location you're measuring? I'm Dr. Nkiruk. I'm a pediatrician and pediatric ear doctor. And today we're going to be doing a 5-minute review on thermometers. So there are 3 main categories of safe thermometers and recommended thermometers for kids. We have the digital thermometers, we have the ear thermometers, but we also have the forehead ones, which are different options we can use. Before we continue, one thing I wanted to put out there: when it comes to thermometers, more expensive does not necessarily mean better. There are a lot of cheaper, more affordable thermometers that are great, and there are also more expensive thermometers that do not actually give you accurate readings. Most pediatricians are going to tell you that the best, most reliable, and most accurate are actually the digital thermometers. This is a rectal thermometer, and this is what we usually recommend for babies under 3 months of age. Of course, when they are that young, the most accurate way to check their temperature is using the rectal thermometer. Rectal thermometers can come in different forms, where you can have these ones as small as this. You can only use as a rectal thermometer because they have the size that makes it enough for you to know when to stop when you insert into your baby's bottom. But you can also have those that are regular digital thermometers, when you can use them as both oral, axillary, or even rectal. So it depends on what your family wants to use. If you want to use a multi-purpose for different kids, making sure you're maintaining hygiene, you can use a regular digital thermometer. Or if you want to be more sure and more careful, you can only get a rectal one and only use it for a baby's butt. So what ages do you use these digital thermometers for? For babies who are younger than 1 year, we highly recommend rectal temperature checks. For babies who are between 1 and up to 4 years of age, we still recommend rectal, but we know at that age our babies are so squiggly and they're not letting anyone get to their bottom. So you can do axillary temperature checks then, even though it's not as reliable and accurate as the rectal. When they get to 4 years of age, you can do oral, which is where they place it under their tongue. And the reason why we wait till 4 is that's when we think our babies are more likely to follow instructions and put the thermometer under their tongue and keep their mouth shut. If you do it in babies who are younger and they are able to open their mouth in between, your readings may not be as accurate, which is why we wait up until 4 years of age to do digital thermometers as oral checks or as oral thermometer check. And then next are the ear thermometers. So these actually work by measuring the infrared rays from your child's eardrum. In babies who are younger than 6 months, the ear canals are super small and narrow, so they're not accurate and they're not reliable. So we usually don't recommend the ear thermometers for babies who are younger than 6 months of age. In babies who are 6 months and older, the ear thermometers are also not as accurate because it requires you placing it properly into the eardrum. And if the baby is squiggly and moving, you may not necessarily be getting an accurate reading for them. So even though these are convenient and easier, you don't have to go into your child's bottom, they're not as accurate as the digital. But you can use that for babies who are older than 6 months or babies whose ear canals are not super small, older than 6 months. If you're also using an ear thermometer, I want you to remember that babies who have been outside or kids who have been playing outside, the cold weather or the too hot weather can actually affect that. So you want to wait for a couple of minutes, between 20 to 25 minutes after your child comes from outside, because the weather changes or the cold air in their ears may not actually help you assess the temperature properly because it may be giving a false reading. The next thermometer is the forehead thermometer, and a lot of us like this one because if there's a non-contact ones, we usually don't have to come as close to a child who's already squiggly and uncomfortable to check their temperature, so we can stand from a distance and check their temperature. A lot of daycares and schools also like this one because it helps them maintain a lot of the hygiene. So this actually works by measuring the temperature, measuring the infrared rays along what we call the temporal artery, and helps you tell the temperature. Wearing a hat, being in the cold or being in the really hot sun before you get your temperature checked by this can make your readings inaccurate. Just like I mentioned for the eardrum thermometer, you have to wait for your child to acclimatize back inside from like a cold weather or a really hot weather before you can check this. So which do I use and which do I recommend? This is mine, and this is a digital thermometer. It is affordable, it is cheap, it's easy to use. For babies who are younger than 1, who are infants, I always recommend to check a rectal thermometer. I like this one because it tells you how much far you can go without having to shove all the rest of the thing in a regular digital thermometer. For babies who are older than 1, I recommend the axillary thermometer check. But if you think your child is super squiggly, you can try the forehead first And if you think the reading is abnormal, maybe too high, too low, then recheck with the auxiliary one before you rush to the ER. And then in babies who are older than 4 years old and they're able to keep their mouth closed and cooperate with you, I recommend the oral, which is one you put under the tongue, because it's actually more accurate and reliable than the auxiliary thermometer check. So one, the rectal, the axillary, and then the oral when they're older than 4. So whichever thermometer you choose or whichever one you use at home, I want you to avoid doing these things. Number one, make sure you're not checking your child's temperature when they are bundled up or multiple clothing, especially babies. When there are multiple layers of blankets and multiple layers of clothing, your temperature might be a little bit off, might be too warm, might be too hot. So you want to take it up and make sure you're getting an accurate reading before you start panicking or intervening for your child. Number two, you don't want to take a temperature when they just finished the bath, depending on what type of water they use, to cold water, hot water. It may just be what you're getting when you check the temperature. Also, when they're coming from outside, like a weather that's super cold and ice and plain, you don't want to check their temperature. Then you always want to give them about 20 to 30 minutes to relax on the temperature to acclimatize again before you check their temperature. If your child recently had a popsicle or a cold drink, an ice cream, maybe a hot drink, you also don't want to check their oral temperature immediately because their mouth might still be cold and hot. So you want to give it some time before you check their temperature. And lastly, one of the most common questions I also get is, when do I add a degree or when do I add 0.05 degrees based on what location of temperature or thermometer or what type of thing I use? Firstly, we consider fever as 100.4 Fahrenheit or 38 degrees centigrade. Depending on where you are, this is what fever is considered. Personally, I do not recommend adding any degrees. It's a lot of math and it's so confusing. We know that a temperature is 100.4. If you check your child's temperature and it's like 99.4, 99.8, and you check if you're auxiliary or check the different means, I would probably say give it a couple of minutes and recheck again. As long as you're not getting those values, it may not necessarily be a fever. If it's a fever that's real, it's more likely to go higher regardless of what means you're using to check it. And I want you to recheck again, and what you're trying to be uncomfortable, then you may want to recheck and treat. But I do not recommend, I don't do any additions when it comes to my kids, and I don't recommend families doing that because it is so confusing. So here are our usual takeaways. When it comes to thermometers, more expensive does not necessarily mean better, and cheaper does not mean it doesn't work. Personally, I like the digital thermometers. I think this is a fix. I'm going to leave a description box or the link of the ones I use or the ones that I like in the description box so you can check it out and see if it works for you. Again, I do not add any degrees when it comes to using different places because I believe if it's a fever, it's going to go higher, and regardless of what means that is an accurate means you check, you're going to see what your child's temperature is eventually. When they're younger than 1, I recommend the rectal check. When they're between 1 and 4, I usually recommend the rectal and maybe the axillary. And then when they're older than 4, you can do oral. The forehead thermometers I usually prefer over the eardrum thermometers because even though they're not as accurate as the digital ones, they're a little bit more accurate. If you're using the forehead and the eardrum thermometers and you're getting a really high reading or really off reading, you want to use a digital thermometer to recheck. And finally, be sure to have more than one thermometer at home. These things can have their batteries dead. You can lose one, and when you need them, you may not necessarily see them. You're doing great as a parent. I want you to leave me a comment in the comment section and tell me which thermometers have worked for you or which ones have not worked. Again, I will see you in the next video. Don't forget to subscribe and don't forget to leave a like and a comment.